Good afternoon, everyone, from wherever you are joining us from. It's usually a very fun time to welcome us to the Yaba Voice webinar. And why do we love this? It's because we educate. It's because we pass out information. We make people's life better. And that's why we're always looking forward to welcoming you to every edition of the Yaba Voice webinar. This month is very unique because it's the month where we celebrated the World Suicide Prevention Day. Actually, it was celebrated on the 10th of September. And the theme this year was changing the narrative on suicide with a call to start action, start the conversation. And that's what we are turning towards today because we need to get our voices heard so more people will become involved and more people will hear, and then we can better save lives because that is what we are all about. So if you know somebody that needs to be here to join this conversation today, can you quickly just tap them and say, oh, we have started again this month's edition of the Yaba Voice webinar. To welcome us formally to this webinar, I want to invite the medical director and the arrowhead of the Yaba Voice, Dr. Olubenga Adekile Oweye, to formally welcome us. Over to you, medical director, sir.
Thank you very much, Dr. Kemi Akintoye. Good afternoon, everyone. I want to warmly welcome you to this month's edition of our webinar called Yaba Voice. Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a social media platform of Federal Neuropsychiatric Hospital, Yaba, Lagos, through which the hospital creates awareness and educate the populace on topical mental health issues. Today's topic is suicide and mental health challenges, the way forward. Suicide and mental health challenges, the way forward. As we all know, suicide is a deliberate and desperate attempt to escape pain and discomfort by taking one's life. And this phenomenon is a major public health challenge with more than 700,000 deaths each year globally. One thing about it is suicide is preventable, and the prevention of suicide requires strategies at all levels of the society. In today's webinar, there are many questions to be addressed. For instance, what do we understand by suicide, suicide attempt, and deliberate self-harm? What are the factors that can make an individual commit suicide? What's the relationship between suicide and mental health challenges? We are also going to discuss today suicide and Nigerian law. Can we change the narrative? How do we prevent suicide? To address this issue are great mental health experts on the platform with me today. Our first speaker today is Dr. Obatomi Alalade. Dr. Alalade is a consultant psychiatrist at the Federal Neuropsychiatric Hospital, Yaba, Lagos. His university education was at Ladoke Akintola University of Technology, Ogbomoso, where he Bachelor of Medicine, Bachelor of Surgery. He had his residency training at the Federal Neuropsychiatric Hospital, Yaba, and obtained the fellowship of the West African College of Physicians. He has a special interest in general adult psychiatry as well as perinatal psychiatry. He is a member of several professional bodies, some of which include Lagos State Psychosocial Response Team, Nigerian Medical Association, Medical and Dental Consultants Association of Nigeria, and the International Rational Emotive Behavior Therapy Group. Dr. Alalade is a mental health advocate with flair for public speaking in various corporate meetings, media organizations, and religious gatherings with the aim of creating awareness in mental health. Our second speaker for today is Dr. Ayodeji Olubunmi Ajayi. Dr. Ajayi is an assistant director of clinical psychology at the Federal Neuropsychiatric Hospital, Yaba, Lagos. He had his first degree in physiology from the University of Ibadan. Also had masters in clinical psychology from the University of Lagos and PhD in clinical psychology from the Lagos State University. He has worked with people with different forms of psychological distress in his clinical and private setting for over 15 years. He uses various psychological measures to assess and treat those with psychological distress to help them achieve emotional stability and wellness. He has been involved in a lot of national and international services. Notable is the involvement with the psychosocial support team for family members of the Dana crash, patients through suspect of Ebola epidemic, as psychosocial support group for COVID-19. It's an internationally certified addiction professional 1 and 2, and also a UNODC global trainer. Ladies and gentlemen, I want to really welcome you warmly to today's program without taking much of our time. The presenter for today, they are erudite scholars in their own rights, and they are here to educate us today on this subject, suicide and mental health challenges. Kindly relax and listen to our mental health experts as we promise you a rewarding session of today's webinar. Over to you, Dr. Kemi Akitoyese.
Thank you so very much, the medical director, for that arousing welcome. And we want to say kudos to you once again, sir, for allowing this to fly and being the arrowhead to ensure that information and mental health awareness becomes something of a good priority in this country, Nigeria. So kudos to you once again, the medical director, too. We want to kickstart this conversation today. And I was telling a colleague here, I said, not so many people know about suicide. It's also a conversation that we really don't want to have. I don't know if you recall that in the year 2020, there was a young boy that was circulating so well on the social media, and everybody was saying the word, "Mommy, calm down. Mommy, be calming down. Mommy, be calming down." But 3 years down the line, what we heard was that the mother committed suicide. How? Why? We don't really know. And that's why we want to open up this conversation. Could the boy have been saying, "Mommy, you need to take things easy"? There was something that was going on, but we really didn't see. But it became a trend that we only were looking at the trend, but we weren't looking at the hidden messages. And how do we get the hidden messages? These are what this conversation wants to address and open up. And so Dr. Lalade would kickstart this conversation with me. But please note that again, we are live streaming live on Facebook. So if you cannot join us here, you can watch live on Facebook. If there's somebody that needs to hear this conversation again, you can also tell them to join as quickly as possible so that they can have first-class information about this conversation today. So Dr. Lalade, what is suicide and what are the types? And then we'll talk about deliberate self-harm also. What we were talking about that, what exactly are we talking about? Over to you, Dr. Lalade.
Okay, good afternoon, everyone, and a big appreciation to the management of the Psychiatric Hospital in Yaba and the Yaba Voice team for these public enlightenment programs that we constantly have. Thank you very much for having me. So World Suicide Prevention Day was celebrated on the 10th of September, and yes, this conversation, changing the narrative, is very, very important. Now, suicide, starting with this quote by Phil Dohem, it says that suicide is a permanent solution to a temporary problem. And that means the problem at that moment is something that over time could be solved. But then once suicide is committed, then it's a permanent solution to a temporary problem. Suicide generally can be seen as an act with a fatal outcome that is deliberately initiated and performed in the knowledge or expectation of that fatal outcome. So the individual knows that this is going to lead to death, and the individual is well aware that this is what I want to do, leading to death, and I know the expectation, which is this fatal outcome called death. There are other terminologies related to it that I will quickly define. There are people that will say they have attempted suicide, and suicide attempt is an unsuccessful approach to killing oneself or to ending one's life, but it's unsuccessful. So it's unsuccessful, but potentially lethal action in taking one's life. People could have suicidal ideation, which is any self-reported thoughts of engaging in suicide-related behavior. So the person could just have a thought to say, oh, I want to take my life, but then the person has not yet attempted or engaged in it. Then there are those that have the suicide plan, those that have made put their house in order, so to speak, before committing the suicide. So you would see some people have written a lot of notes. I'm sorry, mommy, but I just have to do it right now. I don't want to become an embarrassment to you. Some other people could have shared their properties. Some could have bought different items they wanted to use to commit suicide, and that's what we call suicide plan. And there are also motivations to suicide. Why is the person carrying out the suicide? And there is also a concept called suicide pact, in which there is an agreement between two or more persons to take their own lives at certain point in time. It could sometimes occur between those that are involved in some love relationship sometimes, or an agreement. Then there's also the concept of deliberate self-harm, which describes episodes of intentional self-harm that did not lead to death and may or may not have been motivated by a desire to die. So it's not necessarily motivated by a wish to die, but it's just an intentional self-harm that did not lead to death. So it could just be an impulsive thing, or it could just be a way in which the person is trying to get an attention. So these terminologies are related to suicide. But just to quickly say a bit about some epidemiology around it, about 800,000 to 1 million suicide deaths occur globally every year. And for that, we have about 10 to 20 million suicide attempts each year. It's also said by the World Health Organization that every 40 seconds, somebody somewhere is committing an act to kill his or herself. And when we look at it globally, suicide is the third leading cause of death amongst 15 to 29 years old globally. So if we look at Nigeria, based on the data that is available, about 15,000 annual deaths occur from suicide, as reported by the World Health Organization. And for every death, it is estimated that there are at least about 20 other attempts, or about 20 attempts for every death that we see. So it just means that there are about 300,000 Nigerians that are in some form of suicidal distress, that are facing some form of suicidal distress. There are different factors in terms of demographic characteristics, because we need to know that suicide is not just only about I don't have money, then I'm committing suicide. No, it cuts across social status. The higher a person's social status, sometimes it also increases the risk as much as a fall in social status. Then we talk about race and religion. It is less commoner amongst the Catholic. And then when we look at race, 2 of every 3 suicides are from white males. Then we also see that marriage is usually said to be protective. However, it's also seen in singles, or commoner in singles. So this could give us an idea of the demography of suicide in introducing it. Thank you very much.
Thank you so very much, Dr. Alalade. I love the way you started. And that's punchline for me is that suicide is a permanent solution to a temporary problem. And, if from where you now came in from, so it doesn't really matter that I have money or I do not have money. It means that there are deeper things that are going on in the mind of individuals who attempt to commit suicide. And, for me, it's really also alarming with the numbers or the figures that we have available to us. I know somebody just said here now that I'm very sure that these statistics may not even be what is obtainable as at today, because gone are the days when we do not commit suicide in Nigeria. You don't even hear about it. No, it's just done codedly and everything. But just last week, somebody at I think Lekki or something at Jasai was attempting to drop down. People were trying to save him, and this is really, really distressing. And that's why this conversation is going on. I know there are lots of people who needs to hear this that may not be on the platform, but for every one of us who is here today, will be the vanguard, the advocate that will take this message here, that what we are looking at now is becoming highly, the statistics is just getting higher and higher than what it used to be. And so we need to begin to communicate this information to a lot of people. And so Dr. Ajayi will be talking to us. What are the risk factors? What are the risk factors? Why would somebody commit suicide? What would make them commit? I don't want to die. Nigeria is hard, but I don't want to die.
Thank you very much, Dr. Akintoye, and to all our esteemed listeners out there. Yaba Voice is doing a very good job. I want to appreciate you because without you, we can't be here. If you are not joining the link, then this will be over. We're talking about suicide, a very important conversation that needs to be had because it's on the increase by the day. And one of the major things that we need to understand is that every human being has the instinct to protect themselves. They have instincts for self-preservation. But at one point in time, that instinct for self-preservation is actually broken. Then people have acquired capability. What are some of the factors that actually leads to this? The theory tells us that acquired capability to die is actually caused by a lot of ACEs. What do we call ACEs? A lot of adverse childhood events. A lot of people have gone through a lot of things. Then people who are military personnel, the people who have witnessed a lot of trauma, they don't value life any longer, and they feel, dying is just one of those things. Imagine someone who is a veteran who has witnessed a lot of wars, and in his presence, a lot of people have died. People have witnessed genocide, who has witnessed Boko Haram and all those things. They've got to a conclusion that dying is just normal, and for those kind of people, yes, they have acquired capability to die. People who have gone through trauma, people who have accidents, or who have a lot of terrible lifestyle. Then for people who have a passive belongingness, burdensomeness, a lot of people perceive that, my existence is actually a burden to me, is a burden to everybody around me. They believe that, my life is actually causing a lot of people distress. My family will be better off without me. My wife will be better off without me. Everybody will be better off without me. So that's passive burden. They feel they are causing a lot of people a lot of challenge. So because of that, they just feel like just ending it. Then the third theory talks about thwarted belongingness. What is thwarted belongingness? When people are not socially connected to others, people who are isolated, people who cannot mix with others, people who feel, everybody doesn't like me, nobody wants to connect with me, nobody likes to be with me. For those kind of people, most of this is a perception. Just like when people have mental health issues, when they have depressive symptoms, they have cognitive triad. What is the cognitive triad? Negative perception of themselves, negative perception of their environment, negative perception of their future. And they have this feeling of helplessness, worthlessness, and hopelessness. When they get to the point of hopelessness, they feel like dying. So what are some of the other risk factors? We talk about history of suicide. When people have history of suicide, if they have attempted it once, then they are likely going to attempt it. Then if they have family history of suicide too, if someone in their family has attempted suicide, there's a possibility that if someone in the family has died by suicide, then there's a possibility to also attempt it. Then issue of mental illness is actually very, very important. You find out that mental illness is actually at the bedrock of most of the people who attempt suicide. Over 90% of people who attempt suicide have issues issues or one struggle with mental illness or the other. And that's why the issue of mental illness is not something we can overlook. Unfortunately, the Mental Health Act have been passed, but most of these things, a lot of people don't have benefit for it. So we need to start looking at that. Then the other one is substance misuse. There's no way people use substance. Substance causes impaired judgment. When people use substances, there's a possibility that their judgment is impaired, and because of that, they don't even value life. Then recent discharge from psychiatric setting. When people are discharged, in the first 7 days, they are most at risk. The risk is reduced in another 2 weeks, but it further reduced in another 3 months. So when people are just discharged from the psychiatric facility. In fact, I saw a video we talked about follow-up. How do we follow up? A lot of time, people need to follow up. When somebody knows that they are connected to others, just like we talked about trusted belonging, when they know people value them. In fact, I had a client who was telling me that he almost attempted suicide. Then one of the girls in his class just called him randomly. He said he had already tied the stake and was going to go up. But this girl kept calling, and he wondered, before I go, let me just pick a call. And he said, oh, I miss you. And just for that statement, that somebody told him that, oh, I miss you, and because of that, he aborted that attempt. So what are we saying? Being connected with people can also be a very important factor. The recent release from prison, a lot of people are reading. In fact, Nigerian prison is worse. Imagine someone who is released from prison and doesn't have any way to start up in life. Probably don't even know where their families are. So rehabilitation is very important when people are released from prison. But when people are released from prison, they are also at risk. Sometimes they ask themselves, what am I going back to? Where do I start from? Then low socioeconomic status. You find out that, and this is what we are having in this country now. When we talk about low socioeconomic status, we're talking about people's capacity to feed themselves. The major needs of life, their basic needs, feeding, housing. Most of them are very expensive in this country these days. And that's why we need the government to hear this, that feeding, housing is very expensive in Nigeria. And we need to do something about this. So the Aja experience we had early last week is something that is going to continue if nothing is done, because people are dissociated, they feel disenfranchised, they feel really terrible. Some people cannot afford it, just one meal. My wife told me the story of a man who had 1,000, and throughout the night he was just holding that 1,000, and the wife saw him crying, and he said, "This is all we have for the weekend," and that man can eventually end it. A lot of people have ended it that way, so we need to be conscious of that. Then people are unmarried, separated, divorced, widow, people who are isolated, they are more at risk. Living homeless, unemployed or retired, they are also very, very there are people that we need to be a torchlight. Our radar needs to be on this kind of people when you have them in your community. Then physical illness, especially chronic pain, or people who have chronic illnesses that is protracted. Then all those other issues. People have gone through childhood issues like childhood abuse or bereavement. The issue of hopelessness, impulsivity. People are very impulsive. People who are in the military, they are more at risk. So I think we round up with that. Thank you very much for listening.
Thank you so very much, Dr. Ajayi. And what he had told us about the risk factor, you will find out that it cuts across different categories, like Dr. Alalade rightly mentioned earlier. It cuts across different categories of people, different spectrums of life. And so that means what we are talking about today is very germane to human existence, and it's something that we cannot in any way overlook. And so we would now begin to look at what are the warning signs, because sometimes we just hear he committed suicide, or we saw him yesterday, or we even saw him this morning, and all of a sudden he is no longer there, he has committed suicide. How do we know? What are the parameters? How do we understand that something is going on with this individual, and then we need to be able to address it? Over to you, Dr. Lalade.
Okay, thank you very much, Ma. So in terms of the warning signs, from the earlier discussions, we know that 80 to 90% most of the time, anyone who commits suicide, there's usually an underlying mental illness. So a lot of the warning signs are related to mental illness, aside some other things. Now, we know that about 60 to 70% of people who want to commit suicide would have mentioned the intention of committing suicide to someone. And that's a very strong warning sign, which means we should not take it with levity if somebody expresses his or her wish to die. So that intent, that mentioning it, it's a very important pointer. You know, someone was brought into the hospital one day I was called to see, and what they saw was just the person's WhatsApp status, writing different things. Remember me when I die. This world is not my own. Is there even any hope staying alive? And those were just things that some people saw, his church members, and they got scared. Why is this person writing all these things? By the time they could track him and locate him, he was actually beside the beach, just staring into the beach, probably already thinking of how he was going to enter and then end his life. So warning signs, it's very important for us to observe our environment, observe people, because there could just be a change in attitude. There could just be a change in behavior from what we used to know to what we are seeing. Number one, there could be social withdrawal. Again, the person could just withdraw from people. So I know that this person is usually interactive, and all of a sudden, 1 week, 2 weeks is barely not talking, not receiving calls, not responding as usual. That could be a pointer. Like the other things could involve feeling low, persistent feeling of sadness, low energy, not being present or productive at work, not being interested in things the person previously likes to do, marked hopelessness. So the person doesn't just even see any hope again, sees the future as bleak. Despite the person's achievements, even for some people, they just say it's nothing. They feel hopeless. Some of them could feel persecuted and a lot feel guilty. So that's very important for us to take note in trying to look at, okay, is this person feeling this way? Poor concentration in whatever the individual is doing, low self-worth, low self-esteem, feeling I'm not worthy, I don't have value, there's no need for me around. All this could be pointers. The person could have a decline in his functioning, decline in his hygiene. By functioning, if the person is working, you just see productivity dropping, may be absent more frequently than usual, may not even be given what is expected. That could be a pointer. Person could not just be interested in even taking care of his personal hygiene again, just wants to be by himself most of the time. Those could also be pointers to let us know that there could be a problem. And like we said, sometimes suicide could also be complicated, or rather, the person could also be hallucinating, which could hearing strange voices, not heard by others, and that could also be telling the individual to commit suicide. So which could be a pointer of an underlying mental illness. So when we are seeing a lot of active talking to self, active hearing voices of unseen people, that could be a pointer to say, oh, is this a sign? For those that have repeated self-harm, like we mentioned earlier, deliberate self-harm, where the person have episodes of just harming themselves, that could be a pointer because it has been shown that almost about 40% of people who have had deliberate self-harm goes ahead to commit a suicide. So when we see someone, you just see a lot of marks on the hand, on the thighs, either by blades or by any sharp instruments, and you're wondering, why do you have these marks? It could be deliberate self-harm, which could be a pointer to an eventual committing suicide in the future. So it should not be taken lightly to just say, oh, this thing is this. No, not at all. It should be taken very seriously when we see all these signs from individuals. Like it's also very important that just like it's been said, that we should be our brother's keeper. When you see a change in the attitude, this person is usually present every midweek service in church, for instance, and you observe that this person has not been present in the past 2 months, what could be happening? You must be able to look beyond what is being seen to be able to say, yes, it is tough, but can I just find out more? Can I just see more? What could be happening? If there is a change in the person's personality, it could be a pointer. So this person is now being extremely paranoid, possibly, or this person is becoming impulsive, fear of being abandoned. As we all know, some personality disorders could also be precipitating factors to having suicidal thoughts or suicidal intents. So change in personality from what is known could also be a pointer to say, oh, could this be a warning sign? Could this be a red flag or a trigger to say there could be an underlying illness? And when people are going through tough times too, that could be a pointer, because, you know, why would I be allowing my family to spend a lot of money on this cancer that I have? Let me just find a way of killing myself and ending it all because I don't want my family to spend so much money. So that could be a pointer wherein we have to just give a lot of what we call supportive therapy over that time to ensure that the individual stays alive as long as possible. So these are some of the warning signs which we can see, and we'll talk more about some of these other things better in the conversation. Thank you very much.
Thank you so very much, Dr. Alalade, for that. And what Dr. Alalade had shared with us are key indicators that will serve as warning to help us to understand that there might be a problem, or there's a beacon to show that something is going on with the individual, which is also something that we need to be able to address. So with these beacons, that helps us to be quickly monitor and understand if there is an attempt or there is a plan for an individual to die by suicide. And you know, one thing that you said, which is quite instrumental to all of this, is the fact that a previous attempt could also be an indicator. And so we must watch out for people, not just to assume that they had done it once, and so they would not do it again. And so you must be able to watch individuals like that to ensure that it doesn't happen again. Yusuf Jakaye, maybe you should just log in and log out again. I'm quite sure that quite a lot of people can hear us clearly from this end. Please note that you can send questions and comments to the chat box, and then we will be able to read them, or we'll also be able to answer them as much as possible. Yes, Dr. Lillian said there's an advocacy to stop using the term commit suicide. Yes, that's true, as that term connotes a crime. It adds to the stigma. We don't say committed cancer, we say attempted suicide, die by suicide, planning suicide. Yes, that's quite instructive, and that's so important. Yes, we know that. And so we're trying to also change the narrative, and that's what part of what our speakers will be talking about today. And so we want to look at what are the protective factors. If there are risk factors, then also we believe that there are protective factors. So what are the protective factors? And then I would encourage Dr. Ajayi to streamline that, not just the global protective factor, but what are the protective factors that we would have or we can have in our own environment over here. Thank you so much, Dr. Ajayi.
Thank you very much. Looking at one of the things we need to understand about suicide is that suicide is preventable, despite the fact that it's an epidemic. It also stems from mental health issues. It is preventable, and it involves everybody at every strata. Every one of us, all hands must be on deck. Everybody from primary school students, the moment they can understand what is happening, we need to destigmatize the issue of suicide. This conversation is very healthy because we need to talk about it. A lot of people feel, oh, the moment we start talking about suicide, people without giving people auto-suggestion about suicide. That's not true. The moment we can tell them about suicide, it makes the conversation normal. We normalize it rather than hiding and saying it hush hush. And as a result of that, a lot of people feel it's not something to hide. And before we know what is happening, people already die by suicide. So to prevent people from dying by suicide, we need to understand that we need to bring this conversation to the fore, make it open, something that we can talk about. One of the ways to prevent suicide is to strengthen economic support, just like I said. And if anything needs to be taken away by the government of the day, I think we need to talk about strengthening our economy. The economy is harsh. The environment is harsh. People are bleeding. People can seldom eat 3 square meal. Things are very expensive. Can there be ways of cushioning this effect? In some countries, they have the $1 shop where people can buy things at reduced rates and eat. Can we start looking at that at a 100 naira shop where people can enter and eat whatever, or a 1,000 naira shop? We need to look into this. How do we go into all this? Then the issue of stabilized housing. The newly constructed Yaba Bridge, as of under the bridge, either here or on the other side, a lot of vagrants. And because of that, these people are security risk. The country needs to look into this. And housing is so expensive. Now, changing your house, paying your rent, it's very expensive. Some people have been looking for houses now in the last 3 months. They were not able to get. They want a 2-bedroom apartment for 1.2 million, and they can't get. So the government needs to do something about this. Create protective environment. What are those protective environment where we can reduce the means of attempting suicide? For those that are in the military, they need to carry arms. But for anyone that has history of mental illness, we need to restrict their use of arms. It's very important. In some countries, you find out that yes, in Nigeria, sniper is no longer legalized. You can't buy it off the shop. But in some other countries, pesticides have been taken off. They are put in some bank, pesticide bank. If you need it, it is released under regiment, and that follow strictly. You can't just you are not allowed to use pesticide anyhow. So we need to curtail all these things. Create healthy organizational policy and culture. A lot of our cultures are very, very, very toxic. Even in our state, you find that in some states as we have it now, if anyone dies by suicide, that person needs to be buried there. Nobody marries from that family. Those cultures are not we are stigmatizing suicide. With the medical director talked about the issue of the penal code. The penal code still prohibits it. We see it as a crime. We can't criminalize someone who is feeling bad about his life and needs to take his life. We can't criminalize that. So we need to do better about that. Then we need to improve access and delivery of suicide care. What is the access to suicide care in Nigeria? In other countries, we have 988 in America. You can easily call a toll-free line where you can call and speak with professionals, or at least get a first aid. We need to look into this. It's something that needs to be done as soon as possible, where people can have somebody to talk to, and that means also going into some other places, like in the interiors. How do they have access to suicide prevention? All these things are things that the government should start looking into. Increase provider availability in underserved areas, just like I've said. Then promote healthy connections. It's very important. You find out that in some countries now, they have survivors of suicide. They go out together. Or people who have attempted suicide or mental health issues, they go out together. They have a procession, and that binds them together. And beyond that, they have some of them have what do you call it, social media handles. That they join that handle, and they feel a sense of belonging. We need to promote that. It's very important. Then teach coping and problem solving skills. We need to start teaching resiliency skills from primary school. If we don't only teach their cognitive, we don't only develop their cognitive prowess, we also need to develop their psychological prowess, resiliency, problem solving skill, coping strategy. You find out that the truth of life is that people will go through challenges, but being prepared for that adverse situation is also very important. Let them normalize going through challenges. A lot of times, even religious bodies have even worsened this. They will tell you that, oh, my God shall provide. Yes, God shall provide all your needs according to His riches in glory. But everybody, we are in stages and we are in phases in life. We need to understand those realities. So rather than telling everybody that, oh, people are not on the same level, men are in different stages of their life, and we need to appreciate that. Then we need to identify and support people at risk. Who are those at risk? Mental health issues. We need to train gatekeepers, respond to crisis. We need to plan for safety and follow up after attempt. Provide therapeutic approaches. Who are those at risk? People who have mental health issues. People who have depressive symptoms. We need to be able to follow up. The social workers in the hospital are even overwhelmed by the patients in the ward. How much more those out there? We need to be able to train people to go to their house. Look, the follow up with this patient. In fact, the issue of follow up is very, very important in this conversation about suicide, because you find out that when people feel connected, when they see that somebody cares, there's always a willingness to live. It's very important. Lessen harms and prevent future risk. Intervene after suicide. Postvention is very important. Postvention is for family members of people who have attempted suicide. So you find out that a lot of people, they themselves, they feel very depressed. They go through a lot of challenges after this suicide attempt. So a lot of time we don't even value the family members. We don't care. We just talk about the incident and we stigmatize the people, stigmatize the family members. But the family members are going through a lot. Some of them are feeling that, oh, probably I caused this. Probably I should have done this or done that differently. And we need to normalize the conversation that it's not about your fault, that we need to be able to connect with support group and come together with support group. People who have survived suicide. Suicide survivors, if they come together, you find out that they bond, they learn from one another. Then there can be post-traumatic growth. It is very essential. All these things are important so that at every point in time, our suicide survivors, they don't feel at, and for every one of us, we need to understand that every one of us, we need to start connecting. These are the ages of virtual connections. A lot of people connect virtually. You find out that research has found out that when people connect virtually and they don't connect physically, they have increased risk of anxiety and depressive symptoms. So we need to deal with all that. Let's have the physical connection. The CDS are different churches. Now people, they will tell you, I stream online. You don't need to stream online. Connect with people. Thank you very much.
Thank you so very much, Dr. Ajayi. And you will see the passion by which he was talking about this conversation, because there's so much that we need to do if we would indeed put those preventive factors in place so that you will be able to do so well. Remember, you could send your questions and your comments to the chat box. And I want to appreciate Dr. Linian for keeping this flow very high for us. She sent in, yes, I read the earlier one. Okweyemi Uzuego, I'm sorry, pardon me if I didn't pronounce that very well, said, the truth is that Nigerian law sees attempted suicide as a crime. Although that is expunged from our law, it will still be treated as a crime unless it's successful. And that's going to lead us into this conversation that we want to have now. And that's the fact that how do we begin to change this narrative? Because if we're going to move away from here, how do we move from criminalizing it? How do we move away from having laws that does not support all that we are talking about, making, even increasing the stigma? How can we look at the cultural factors, the religious factor, and ensuring that there are better mental health laws or policies in place that would help people to be able to talk about this conversation adequately? Dr. Lade, how can we do this? Over to you, sir.
Okay, thank you very much for the question. It's been a very interesting conversation thus far. In changing the narrative, it starts from, I would like to start from our law, right? Nigeria, according to the Nigerian Penal Code, Chapter 27, Section 327, any person who attempts to kill himself is guilty of misdemeanor and is liable to imprisonment for 1 year. And that is what the Nigerian law says. So any attempt, it invariably just means that any attempt must be successful in quotes. Because once it's not successful, the person gets punished for attempting suicide. Nigeria is among about 25 countries in the world where suicide still remains a crime. The law is a colonial law, like we all know we're colonized, right? And it was brought, even those who brought it into the country, they've changed it in their countries, but Nigeria still maintains it as a crime. The law attempts to stop the act, meaning don't commit or don't try to kill yourself. However, it does not stop the thought. It does not stop whatever is going on in the person's mind, because if one attempts suicide and is unsuccessful, the person gets arrested, the person gets tried and sent to prison, does that stop the person from wanting to attempt it again? So the law is only stopping the act, but not stopping the thought. Does that stop the mental illness, for instance, the person has, or does that stop the unemployment issues that led to the person to want to attempt suicide, or does that stop the housing problem or the depressive symptoms the person is having, or the hallucinations? So it is still a very big problem in our country because of that law. And the law is just to be followed. So anybody who is caught in the act, who attempts it and is not successful, is liable to 1 year imprisonment. And that is why this conversation is very important, because in changing the narrative, there has to be a change in our policies, in our lawmaking. There has to be championing in the Senate, in the House of Rep, following conversations like these, in which this law has to be changed. If things are, yes, we know mental illnesses could predispose to suicide, but if things are well managed, if social determinants are well controlled, if people have mental illnesses and they could access care, it is available, it is accessible, it is affordable, then the risk or the rates of suicide would reduce. But even those who have the illnesses, there is little or no way in which they can have the care. How many government hospitals provide the care to be able to support them so that they don't attempt suicide? These are the things we need to work on as a country in terms of policy, in terms of helping change the narrative. We mentioned it, we have to put it in our insurance scheme. Let it be something that is affordable for people so that when they have illnesses that are related to mental health, they can do something about it. But how many of these things are covered by the National Health Insurance Scheme to be able to assist people to take good care of their mental health? Very little. So this law is a law that needs to be repealed. This is a law that needs to be changed, because people should not be punished for wanting to attempt suicide, having going through a lot in their lives. Culture also plays a very big role, and that's part of how we can change the narrative. In my own, some people say this, like in the Yoruba language, they say ikuya jesin law. So if you are facing an embarrassment or you are facing something that may lead to tarnishing your image, you rather attempt suicide and probably see that it succeeds than being faced with that embarrassment. And so some cultures just say that, oh, it's just better that we just go, so that we will not face this embarrassment, or have embezzled billions of naira or whatever. I don't want to be embarrassed. And so our culture needs to be changed, right? The pressure puts on men, because men are also at risk in terms of completing suicide. The pressure should also be reduced. You need to achieve this, you need to do that, you need to have gone to this thing. When these pressures get too much based on cultural rules and expectations, it could also lead to suicide. So we need to work on it in our culture in terms of making sure that, okay, the pressures are reduced. In terms of societal expectations, it could be pressure as to get a child, or it could be pressure as to be in a relationship, or get married. All these societal pressures or cultural changes needs to be worked on, because for some people who are already predisposed, that could tilt them to just ending it all, to say, well, I can't keep going through this shame, or I can't keep going through this pressure, and then I have to go out of it. Religion could also help in changing the narrative. I used to say that if religion was probably not a part of our world in African countries, Nigeria in particular, maybe a lot of people will come down with mental illness. As much as there could be different arguments for and against religion, it has served as a very good social support for people in times like this. For instance, we're in a country wherein we know fuel price has increased. A lot of us are now in band A and everything, but we still need to hear words that give us hope, right? Or else a lot of people would probably have gone to attempt suicide in one way or the other. And so we just need to channel that our religious leaders would ensure that they speak these words, and set up different units where people who are going through a lot of mental health challenges can access care, and see different foundations that can provide affordable, accessible, and available mental health services. We look around us, how many facilities are bound to be able to support people with mental health needs. Those that are private, how many private hospitals, how many people can afford it? So all these things are quite important, and I believe that religious bodies also play a very big role in helping changing the narrative on society, and pushing to the government to be able to see how this law is repealed. Again, we need to reduce stigma in terms of those that have probably attempted and were unsuccessful. People like that could actually come out and then become advocates in terms of now talking about it. Oh, I once attempted suicide. I once went through a depressive phase, but thank God I could receive care, and right now I'm fine and I didn't do it. That could be a message of hope to some other people, just the way we have breast cancer survivors, and then they form a foundation, and then you start seeing people talk about their challenges when they went through that, and how they were able about suicide. I was listening to a webinar not too long ago, and I was a pharmacy student who said at his third year, he wanted to commit suicide. In fact, he had planned everything was set until he received help. A friend just said, no, you can't do this, and he got help. And interestingly, this guy came out with a first class in pharmacy. But if he didn't receive that help, he'll probably have gone and it would just be another trended hashtag. So it's very important that people could also come out. Another way of changing the narrative is through social media, right? Social media could be bad, but it could also be good. We know there's a lot of cyberbullying here and there. We could also predispose some people to want to attempt suicide, but we could change the narrative through the social media, changing it into something good. There could be threads, there could be Twitter spaces, there could be conversations around suicide, talking about it, wherein in the long run, one could then direct people to where help can be received. Because when people don't know these things, right? Some people are not even aware of all these statistics that we are reeling out or talking about. But when people know, when they see how it is through the social media, different platforms, we could use that to change the narrative on suicide. We could use that to engage people and then, in fact, prevent a lot of people from doing that. I remember that there was a time in which we had a radio presentation and went on a radio program early in the morning, and we're just talking about mental health generally. I think we just briefly branched into suicide. Interestingly, a lady was actually driving her car and she had plans to go and take her life. But luckily, she was just listening to the program and heard that, oh, there could be help in psychiatric hospital, Yaba. And what if I tell you that the lady presented in the hospital that day? And she said it was that program that she listened to, and then she decided to come. And so these things like this could also help change the narrative. And that's why I'm grateful for this program, which would make people know, and then we can see how help can be received. Thank you very much.
Thank you so very much, Dr. Alalade, for that. And that is very germane to the conversation that we are having today. You know, there are so many things that can be done if we will change the narrative. And it starts with every one of us playing our role, doing what we need to do in changing this narrative. Dr. Lillian said, suicide plan is having a methodology in place. Will drive car over hill going somewhere to hang self, use a knife, take a drug. But sometimes if plans are in make, the risk of implementation is still quite low. A plan to hang, don't leave the person alone. A plan to use gun, overdose, remove gun, remove medications, take away keys, and other things like that. Thank you, Dad, for that contribution. Samuel Amal said, beautiful format, and yes, we tried to adjust the camera. Thank you so very much for that. Oluwagbemisola Osobo says, thank you, Yaba Voice, for a comprehensive and enlightening seminar on suicide prevention, and it's been insightful. And it went on to talk about what had been discussed. But significantly, it says this, talking about the acquired capability for Thomas Jonas' interpersonal theory of suicide. He said this idea emphasizes how humans naturally have self-preservation instinct, but certain factors can diminish it over time, leading to the development of an acquired capability for suicide. This was a new and profound insight for me. I also learned the need for resilience and also teaching children proper coping skills as crucial preventive measure in promoting mental resilience and well-being. Yes, Dr. Lillian said again that not only does the law not stop suicidal ideation, but it's a traumatic event that can worsen suicidal ideation. Abolale Awonu says, good job. We need to leverage on technological advancement vis-a-vis the ICT. People should be encouraged to speak out and share their feelings through calls, text messages, etc. Toll-free lines should be provided and made accessible to all. A problem shared is a problem half solved. Yes, Oluroti Ojalade says, I'm happy I didn't miss the session. Kudos to our lecturers today. Bala Briggs says, this is such an educative and insightful session. Thank you so much for the brilliant and amazing thing. Thank you too for joining. Dr. Adekola Oluwafunmilayo says, great presentations. We also need to go back to the basic caring for each other genuinely. And I think that's very germane to this conversation. Yes, Dr. Linian, says there is an advocacy to stop using the term. I think I have read that earlier. Okay, so deeply sad and so true. That's Bala Briggs. He said, in addition to suicide being expunged from the law, I hope the much needed support is also given to the person. And that's why we are talking about this, so that every one of us knows that we have something to do, whether it's an attempted, it's a planned, or it's also death by suicide, that we have something to do. Because you can even consider families, members whose loved one had either attempted or had died by suicide. Sometimes it could be really, really devastating for them. Yes, Grace Ayela Bola said we need to care for one another, checking up on one another, welfare call. And I think this is just about the time that we need to do more of this, so that I know we can have more people navigate life's challenges adequately and developing resilience and know the grace and prowess to be able to go through that effectively. Now I'm going to ask Dr. Ajayi, for people who have relatives who have maybe attempted or who had planned, they had planned or suicidal ideation, or who have deliberate self-harms and other things like that. How do we help them? What's the take home for them? What can people do without first coming to the hospital first? Is there something that we can do? Over to you, Dr. Ajayi.
Thank you very much, Dr. Akinto Ishe. It's important because you see, most of these things are not so far away from us as we think. A lot of us feel it's something alien. We used to feel that way until a lot of times we find out that things are coming up. In fact, in 2019, there was a write-up that showed us that within a space of 72 hours, about 8 people died by suicide. 8 people, pastors involved, laymen and others. You see, all these things are closer to us than we think. And that's why this conversation is very important. We need to change the narrative. And how do we change the narrative? Every one of us needs to be educated. Undergraduates, postgraduates, our community, and even professionals need to be educated. So I was listening to YouTube, and somebody said, he said, ask the professor, a professor of psychology, that what do I do if I see somebody that is willing to die? And that was in America, and the professor just looked back and said, when people want to die, you can't stop them from dying. And that's just it. And she said she felt really absurd about that response, and she needed to go and find out what can we do to help people, because she has seen a lot of friends who are in that condition. When people want to die, they can be stopped, and the only way we can stop them, you see, connectedness is very important to this kind of people. Social support, you can't overemphasize that, but all these things start from our value system. We need to change our value system. Our value system, we are becoming disenfranchised now. We are disintegrated from one another. People don't value one another because of the inundating issues in the country. A lot of people are not even bonded any longer. If you call them on phone and if they don't pick, that is their business, and you move on. Someone was talking. I went to a show, and somebody was talking about a sibling. They were staying in a 2-bedroom apartment, shared apartment, and they share the same parlor. And the boy died in the house for 2 days, and the sister didn't know, because we don't care any longer. We need to change our value system, and all this things start from primary school. We need a national reorientation of our people. And humanity should be our religion. A lot of times we talk about a lot of things that don't really matter. You find out that at your deathbed, nothing else matters to you. The only thing that matters to you is humanity. The moment you find out that a lot of time when we see people, look at the man that wanted to attempt suicide last week at that bridge. Look at everybody running around. At that point in time, nobody was asking, is he an Igbo man? Is he a PDP member or an APC member? Nobody cares about that, because we are looking at humanity. We need to do more about this. We need to value humanity. And because of that, our value system needs to change. Then if we value one another, we will be willing to cross rivers for one another. These days, people call one another on phone, and we don't attempt to even visit them. During COVID period, a lot of people on my CD, they said the CDC reported that about 3 people died in the house in different CDAs. They died during the period of COVID, and nobody knew. Some of them were dead for days. Some of them for almost a week. All these things are foreign to us. We hear about them in America and all those developed countries, but we are getting there. So we need to understand that we are also there. So we need to do something about it. We need to be more connected with ourselves. We need to also, when people mention it, even if it's for anything. But probably some people may just mention it because they just want to rouse our sentiment. Even at that, the moment anybody says they want to end their life, it's something to be taken seriously. It's something to do something about. Yes, some of them may actually be playing the sick role so that they can extort money from us. So, but even at that, we need to do something about it. Don't allow such things to slide. It must not slide. Follow up is very important, and it's also important for every one of us that when we have people with mental health issue, we need to follow up on their medication and ensure that they are visiting the clinic. All these things are very important because if anything changes, you find out that their mental state will just change. Mental state is very dynamic and it can change at any point in time. We all know that. And because of that, we can't just say, oh, it's fine. I called him last week and it was fine. Oh, he's supposed to see his doctor. He's not seeing his doctor. That's his own business. No, it's not his business. It's everybody's business. Because if it happens, it will affect you. It will affect a lot of people. Don't forget, suicide is not just about the person. It affects every other person. A lot of people will be traumatized and some may not be able to come out of the trauma very quickly. So we need to educate those people that are involved, the family members. We need to ensure that they support and probably get help from professionals. Thank you very much.
We need to ensure that they get help. We need to be a support. We need to be there. It's not just the individual's problem, or it's everybody's problem, because quite a lot of people will be affected. Thank you so very much, Dr. Ajayi, for that. Grace Ayala Bola, I think I've talked about that earlier. Abiola Shoremeko says, thank you, Yaba Voice, for this insightful session. Oluwafemi Sila say, government should scale up social services to meet the needs of a citizen. I agree with you. Pamela Udoka says, what a coincidence that I just referred a client with suicidal ideation to Yaba. She is actually in the hospital now. We can't overemphasize the place of love, care, compassion, and empathy, and referral. This is a very good program. Kudos to MD Dr. Weye and his team. Thank you, Yaba Voice. Thank you also everyone for being on this call, and for as many of us that had made this webinar quite insightful by your comments and your questions to the platform. Professor Fatai says, great webinar by the Yaba Voice as usual. There are still a lot of milestones to be attained, and these with concerted efforts authenticating the strangulating and toxic situation in our environment beyond legal reform, among others, can a long way to deal with the idea of suicide. I agree with you, there's so much to do. And that's why we're kickstarting this conversation to see how we can begin to disseminate the information and be of great help to quite a lot of people. And Dewale says, very insightful, truly. Hope to get the recording, please. The recording is going to be on the Yaba Voice YouTube page, so you can easily access it. Yaba Voice, FNPHY, one word. Yaba Voice, FMPHY. That's our YouTube page. And so you can easily get the recording there. It will be uploaded as soon as we conclude this webinar. So thank you. Olusoya says, thank you so very much. Very insightful. We need to engage more in communal living. I think it's something that we have left off. And it's also something that's very frightening to a lot of people, but it's also something that we need to get back to. Yusuf, I can see your hand, but we don't take comments here on the on this call. You could just send in your comments to the platforms. Oh, okay. The YouTube page will be sent to the platform. Mr. Wale, please do that for us quickly. Yaba Voice, FMPHY, one word. You would get this recording as well as previous episodes of the Yaba Voice recordings there. Abiola Shoremeko says the law of conviction of suicide should be scrapped. Yes, I agree with you. And there's been a lot of conversations around that to ensure that that is totally expunged from the law. Yes, thank you for the presentation. Yes, Yaba Voice YouTube page, that will be sent to the, okay. All right, so it's been sent there. Yes, Bolugbemi Sola says, as a young psychologist and future clinical psychologist, I've learned a lot from the seminar through standing on the shoulders of my elders who had gone far ahead in the field. This is really a golden moment. Suicide can be prevented. Yes, that's the word. That's the word. Right from we started this conversation today, suicide can be prevented. If only we all know what to do and how to do what we should do. Yes, Billy Wu says, great initiative, well done. Thank you so very much. Please, like I said, the recording is on Yaba Voice FMPHY, one word. You can get this recording as well as previous episodes of the Yaba Voice programs or webinars on that platform. I will take the last word from our speakers today. Dr. Lalade, one last word from you. What's the take home? Just that punch line so that we can leave this. Dr. Lalade, over to you.
Thank you very much. I appreciate our time. Last word is that suicide does not end the chances of life getting worse. It actually just eliminates the possibility of it ever getting better. Because once it's done, it's done. And so we need to change the narrative. We need to know that there is help. Thank you very, very much.
That's so you won't know if there's something better for you. You won't know if there's more to come. And so suicide will terminate that. Yes, you think the problem is over, but you won't even know that there is a better life for you. Thank you so very much, Dr. Alade, for that. Dr. Ajayi, last word.
Thank you very much, Dr. Akinto Ishi. And to all our esteemed listeners, we need to understand that humanity is our goal. We need to change our value system. We need to connect with one another. Suicide is preventable, but there are things you will do. For those that are thinking about suicide, we need to change their cognition. For those who are in the community, we need to help. Then the government needs to do a lot to improve the toxic situation in the country, especially the economic situation. Thank you very much.
Thank you so very much, Dr. Jai says we all have a role to play in the community, everywhere, even in the church, in the mosque, everywhere. Let's play our role. Let's just be there to play our own part and ensure that we end this and then it doesn't become a menace in our environment again. Yes, King James says, great insights. Thank you so very much, Dayo. This is very educative. And it's coming at a time when we're having increase in suicide. Yes, we need to do more in the area of educating the public on how to do. So please be the vanguard. We have shared information with you today. Please share. Just click on the Yaba Voice YouTube page, this recording, share to as many platforms as you can so that the message would go far and near and then people can get to understand and hear so very much beyond where we can get to. You can be the vanguard that will be there. Big appreciation to our speakers and the moderator. God bless your effort. Thank you so very much. And next month, we trust God that He will keep us alive and then we will be able to come your way again. And next month is also the mental health month, or there is a celebration of the mental health day. And this year, the focus is looking at prioritizing mental health, even in the workplace. You know that quite a lot of people are going through emotional challenges, even in the workplace. Work is good, but it could also be a trigger for quite a lot of emotional things. And that's why we'll be looking at that conversation next month. So please get yourself prepared. Third Thursday every month, God's willing, there is no emergency or anything, we would be here. So Thursday, by the grace of God, we'll be here to also share insight with you. And I can trust you that we'll be bringing erudite scholars who would have this conversation with us on that day. Until we come your way again, thank you so very much, everyone, for being on this call with us. We quite appreciate your time and your commitment to ensure that we always have a big outing like this. Remember, you can subscribe to the Yaba Tube page and also share out just information about these recordings as well as previous episodes of the Yaba Voice. So until we come your way again, please understand the suicide is not an option. It is not the solution. As a matter of fact, it's a permanent solution to a temporary problem, and that would not help you in any way. The future is bright. So no, this time too will pass. It's a phase, and then you can always overcome and deal with the challenges. Thank you so very much. On behalf of the medical director and everybody on the Yaba Voice team, I say thank you. Please, can you assure us the recorded webinar? Oh, yes, it will be there. It's on the YouTube page, Yaba Voice FMPHY. Yaba Voice FMPHY. Yes, you would get this recording. As soon as we finish here, it will be uploaded on the YouTube page. Thank you so very much. Bye-bye. Take care of yourself. Bye-bye, Dr. Lalade, Dr. Ajayi. Thank you so very much once again. Thank you.
Thank you
Bye-bye.
very much.
Thank you for a good outing.
Thank you
Thank
very
you.
much, everybody. Have a wonderful day.